Welcome to the Fertility Podcast. I'm Natalie Silverman, your host. I've been using my voice in my work for about 15 years now. I used to be on the radio. Now I'm podcasting and do a lot of voiceover work. Now, the Fertility Podcast has a whole host of episodes for you, from adenomyosis to zero sperm. It's a total A to Z of all sorts of things that affect you on your fertility journey. I'm mum to a little boy called Phoenix after having successful ICSI treatment, and that was my reason for starting the podcast. And I hope that if you found us, then you'll realise that you are not alone. This podcast is to help educate and empower you. I've brought together as many experts and tried to share as many of your stories as possible. And I now have my wonderful co-host.
I'm Kate Davis, a fertility nurse consultant, and I'm adamant that we can all do so much better at understanding our fertility. I'm really passionate about teaching you to take ownership of your fertility, teaching you practical steps, emotional coping strategies, and lifestyle changes that you can make to hopefully optimise your chances of conceiving.
Right, I want you to just come here and do something for me.
Do I need to sit on the seat?
Yeah.
Sure.
Let me get. Okay, nice glasses. Can you just say, stay home, stay safe, and protect the NHS for me?
Stay home and stay safe and protect the NHS.
Nice sunglasses.
They're not sunglasses.
What are they?
Star glasses.
Oh, nice.
Let me just get this up.
Is that your phone?
Yeah.
Right, off you go. Okay, so now you know who we are. Just a quick note from me. As you can hear, I've got company. Another episode in lockdown, and I hope wherever you're at, you're doing okay. It is just incredible to see what our brilliant frontline workers are doing, as I think I've been saying for the last few weeks. I feel kind of redundant in what I can do to help, but we're going to keep putting out the content. And also I'm doing some Insta lives, so if you're not following me on Insta, it's at Fertility Poddy. I'm doing one on Monday, one on Wednesday, both at 12:30 GMT. More to come, so it'd be ace if you can join me. Before we share this episode with you, which is a conversation with a lovely lady called Kate, who is a fertility nurse who I actually met a good few years ago visiting one of her clinics, she got in touch to ask if we were keen to talk about her experience of miscarriage, because she was diagnosed with a severe progesterone sensitivity. And one of the things that we are doing with the Fertility Podcast now is trying to share some of the more unusual stories of your experiences, because we are all so different. And say the story you're about to hear, which is actually a pretty rare example, but say there is any similarity in something that you might have experienced and it helps you know that you're not alone in this situation, then we've completed our purpose. So if you are dealing with a more unusual scenario with your fertility status, let's call it, do get in touch. Do let us know. You can email info@thefertilitypodcast.com. Now, last week we shared a bonus episode, which was a conversation with Medichecks talking about their home fertility blood tests. And I'm really chuffed to share that Medichecks are sponsoring the podcast, because whether you are trying to get healthy before trying for a baby or investigating why you're not getting pregnant, Medichecks has a range of simple home blood tests developed with our very own Kate Davis to help you. So just visit medichecks.com to find out more. And now, enjoy the episode. One of the things that I love about this podcast is that the point of it is to get people to tell their stories. And you'll know if you've been listening for a while that we've spoken to a whole host of men and women sharing their stories, as well as the expert interviews that we do. Quite often they come from the contact that you've made, whether it's on social media or it's an email. And this conversation today is exactly that, an email that I'd been sent. And often what I do is I then send it to Kate and I go, what do you think? I was just looking back at the email that I sent you where I went, wow, shall we talk about this? And you were like, wow, yes, let's talk about it. And I don't want to say too much because we're going to introduce this lady called Kate, another Kate. Kate talked about something that I had never heard about. Do you want to explain, Kate?
Yeah, well, interestingly, I've never seen it either. So I was so keen to talk to Kate about it. And basically what she suffered with is a really rare disorder called progesterone hypersensitivity, and how that affected her during her IVF treatment. So this is a real fascinating chat, but I want to say definitely it is incredibly rare. So I don't want anyone to be panicking and worrying. It's a rare disorder, but incredibly interesting.
Well, here's Kate, and then we'll catch up at the end, and we'll put all our details as well if you've got any questions. But as Kate stressed there, this is the more unusual podcast episode, so this is a total caveat. Do not listen to this and freak out, okay? That is one thing that we want to stress. Kate, I really appreciate you reaching out, because I know that you've kind of reached a point where you now feel happy and ready to talk about what went on with you, and it'd be lovely to just get an overview from you of what happened.
Being me, I have a lovely sort of menopausal brain, so I'm being really organised, and I've made some notes.
Great.
But really, to sort of start, I was very much just, I say, an ordinary patient, but I started on the fertility journey very much like most of my patients did. You know, we tried conceiving naturally for a couple of years, and nothing had happened. We'd gone through our secondary care at the hospital with some rounds of ovulation induction, and again, sadly, nothing had happened. And then obviously I'd moved upwards to IVF and tried IVF using my own eggs, and first cycle was unsuccessful, and the second cycle I didn't respond at all, which was then that they'd picked up that I was kind of entering an early menopause at the age of 35. So again, there were lots of things going on, and then my husband and I took some time to decide what do we want to do, and then we were really fortunate to have one funded cycle left, where we were able to actually have a cycle using egg donation, which was, you know, offering us our best chance really of potentially having a family. So we waited a little while for the right donor, and when the right donor did come along, I had normal treatment, just as you normally would as an egg recipient, and everything went really well. And I found out a couple of weeks later after the embryo transfer that I was pregnant for the first time ever,
Wow.
which was really, really, you know, never ever got that far.
Yeah.
Amazing.
Really, really good news. I had all of this at the clinic that I worked in Bourne, and the staff were just fantastic. They were all probably in tears more than I was. I think I was still in shock. I'm sure a lot of your patients say you never imagine you'll get that far, really. You're just living from day to day.
Absolutely.
And from, you know, one test to the next test, and this time it might be better, it might not. So, yeah, it was really, really good news. But in a nutshell, after that point, I remember getting my blood test done and not believing the result, your beta-HCG result, which Kate would probably relate to, you know, thinking, no, that can't be right. I've never got that far. Never got that far before, because my husband and I had tested and the line was so faint. I was like, don't be ridiculous. No, don't be silly. So I'd kind of gone to work and, you know, had a really busy list for the day and said, can you just put me out my misery? And then they said, oh, no, it's really good. And you're like, what? Really? Me? Are you sure that's me? So, yeah, up until that point, things were really, really positive. But sadly, sort of about a couple of days after I'd got the positive test, things just took a dramatic downhill turn, really. I started to feel really, really unwell. I started to have quite a lot of problems in terms of overall swelling, particularly in my pelvic area, which was really painful and really uncomfortable. Almost like you're sort of getting a burn would be the way I would describe it.
Ow.
And things just got really, really worse from there. The clinic were really, really good. They swapped over my medication to injectable progesterone rather than the lovely progesterone pessaries that all you lovely patients all relate to. And then things just got dramatically worse. I was literally covered in rashes, sort of burns, and had some of the most severe symptoms. And you just think, is this actually happening? Is this me? I think it's the only point I think I lost about 6 or 7 kilos in about 2 weeks, and all my friends and work colleagues would know that's not normal for me. I'm normally guzzling chocolates, begging patients to come in and bring chocolates, and all the classic sort of hormonal changing symptoms when you look back at the time: anxiety, weight loss, gastric symptoms, vasomotor symptoms, severe insomnia, to the point where I couldn't tolerate any of the medication anymore. So unfortunately, they just decided to stop everything. And it was then, sadly, a couple of weeks later that I unfortunately then had a miscarriage, because, as you know, you can't maintain your progesterone support. Things can't sort of continue if you don't have the sort of body that can do that naturally, unfortunately.
So, I mean, when you first emailed us, Kate, and you said that this had occurred to you, this progesterone sensitivity, and I know it's incredibly rare. I've never seen it in a patient to the degree that you've...
I've never seen it.
No, and to the degree that you've explained it, I mean, certainly I do see women who are taking progesterone therapy after embryo transfer and they might have insomnia. That's quite common.
Yeah, me too.
And obviously we know that progesterone in a natural cycle, not thinking about fertility, but generally women can be sensitive to progesterone. But it's so rare, isn't it? I mean, like I said, I've never seen it, and you've never seen it.
No,
So
and I just remember looking around at sort of 4 consultants at Bourne Hall, and some of them had been practicing for years and years, and just sort of sitting there saying, "So what is it? You know, has anyone ever seen this?" And they're all just kind of looking at me, going, "We've never seen this before." And and you suddenly think, "Well, somebody must have." Really. But yeah, it was exactly the same. That those classic, as you say, PMDD symptoms for ladies with progesterone in the just before their period, those sort of symptoms we see, and ladies with some sensitivity. But yeah, to the degree in the end where I was on prednisolone, steroids, creams, they had to refer me back into the NHS. They really did try everything that they could, and it just seemed to get worse and worse, which would make sense, as we know, in early pregnancy, because your progesterone starts to increase.
So can I just ask a kind of layman question?
No, go ahead. Yes.
Because I thought there was some link between progesterone helping prevent miscarriage as a reason that you're on it.
Yes.
Okay. And so do you have the progesterone as part of your cycle, your IVF cycle after, don't you? And then you had such a severe reaction, you have to come off it, and there's no alternative to it.
No,
right?
they tried to administer HCG, which is a very old way of doing it, where you would give ladies HCG and it would help to stimulate your corpus luteum to carry on sort of managing. But really, there isn't a lot else that they can administer really in its place, because it's such a specific hormone. I'm sure Kate might add something, that is such a specific hormone at that point in the pregnancy that you need.
Yeah, I mean, if you think about kind of biology and with the corpus luteum, and it's called, I love the term corpus luteum.
I do.
Because
but what is it?
So it's what it says. So basically, once it's the casing that the egg is in, once you ovulate, you have the casing of the egg that dies off, hence corpus. And as it dies off, you get a raise in progesterone levels, and those progesterone levels stay elevated. And in pregnancy, the corpus luteum creates the progesterone until the placenta takes over at about 9 weeks.
That's amazing.
Yeah.
So that's why it's so important, and that's why you have early miscarriage in some. I mean, there's so many reasons why women have early miscarriage, but that's one of the reasons, because your progesterone levels will plummet and therefore the pregnancy doesn't continue. And that's why often with IVF treatment you'll have progesterone therapy to support that luteal phase after embryo transfer. So that's really sad, Kate, that you then unfortunately, for your own health, you had to stop.
Oh, it was.
But unfortunately, then went on to miscarry.
Situation, but there wasn't really anything else to do, because it had just become so severe that you just had to sort of think, well, how much longer can you sort of keep ploughing ahead and keep trying to keep going when you're just getting sicker and sicker by the day. And it wasn't an easy decision, but it was something that had to be made, really.
And then you had to go through the miscarriage, and then, sorry if this sounds kind of crass, but were you like instantly recovered? I don't mean.
No, I understand. No, not at all. In my mind, because I think at that point your mind is so sort of perhaps hormonally overwhelmed and imbalanced anyway. In my mind, I was thinking, well, it's been 3 days or whatever, I'll be absolutely fine. But actually, it really took many, many months of recovery, really. I was very much in the grief point at that point of denial, that I don't want to talk about it, don't want to deal with it, don't want to go back. And it was actually my mum and one of my good colleagues and lovely nurse and close friend at Bourne who'd said, you really need to go and see someone and find out what happened. And I was like, no, definitely not. Just put it all to bed, pretend it didn't happen, and hide away in my little scan room and see all these lovely ladies and, But then I thought, well, actually, you're right, because my mum kind of said, well, what if it happens to someone else? My mum is just a superstar and kind of said, right, I'll pay for you to go private, find someone who you want to see. And I went to see Professor Conway, who was a reproductive endocrinologist in London. And it was so refreshing to talk to someone who, had actually heard of it, rather than sort of people sort of going, He kind of said, yes, I have heard of this, not to the severity that you've had, but I've definitely heard of it. And you kind of knew he was interested because he was kind of getting his iPad out straight away and making notes. And, you think,
Oh,
okay.
100%. Yeah. I mean, before we've spoken, I've done a bit of research into it and could actually only find one literature review. I don't know whether you've read this one. And it talked about the different severity of the condition, so dermatitis, urticaria, and then going on, and then talks about one 26-year-old woman who had facial and lip edema, bronchospasm and hypotension. And that's really the only reference to a severe condition. So I'm surprised they've not written you up.
Well, he was making a lot of notes on his iPad. He was very clear and concise, because at that point we still had an embryo in storage. And at that point he was very much trying to plan what he would do if we tried again. And it would basically be a lot of practice runs with different levels of progesterone and steroids and things like that.
And were they going to because again, I've read about desensitization therapy. Were they looking at that then, a bit like when you're allergic to wasps and you have a little bit of wasp, whatever it is, not sting, whatever it is, and to get you through that process?
He wanted to try some almost, like you say, dummy runs, and he was basically saying, well, what have you used before? And obviously in my unsuccessful cycles, I'd used various progesterones and never had a problem, because obviously it never went up that high. So he was kind of devising plans of what I would use, what I would do. And at that point, he kind of said, well, recovery can take a long time. But he was really focused on what happens mentally, which was the eye-opener for me. Because my husband was at work, so I'd taken my mum along. And again, she's so handy at doctors, because I said, I was fine. I was a little bit anxious. And my mum kind of looked at me and went, you were absolutely mental, Kate. She went, you wouldn't have even realised. She said, but you were almost sort of mania. So it was actually the mental, the impact on the brain. And I just thought, wow, that's actually really interesting. And then, my nursing mind's kicking in, thinking, wow, that's really interesting that hormones could be responsible for all of this.
Fascinating.
So, I mean, I'm a bit dumbfounded by this. Not dumbfounded, but I'm just amazed that there's such a different level of things that can occur. And I know that, Kate, you're wanting to talk about it in case it is something that somebody might experience. But it's taken you a while to feel ready, hasn't it? And I'm also wondering are you still working in Bourne amongst the whole fertility setting? Because I imagine that must be quite triggering for you now.
I did leave and have a break, which actually was the best thing I could have done. I didn't want to, because I still call them my Bourne family. They were so supportive. They really are. So I think having a break was the best thing I could have done, just to break the link as such. I had lots of counselling, and I also had some CBT counselling, because after seeing the professor, knowing that it wouldn't be, well, next week you'll be fine. It was actually, well, you're going to have to deal with some of these symptoms for a bit longer. So let's get positive and learn how to deal with them so that you can get out there and still kind of live a normal life. So it was, learning how to deal with those symptoms. So having the break was actually brilliant, because I kind of could start somewhere with a bit of a clean slate as such. And I think it was probably more easier on the lovely girls at Bourne as well, because they all found it so heart-wrenching just as much as I did. This is when I took some time out and started my postgrad in reproduction, because I was determined to say, I need to find out more about this. I need to find out more, so that not just on this, just everything. Because like you, Kate, I was just fascinated. So it was a really, really good time to divert my energy into something positive, so that I felt that I could get some more knowledge and then start to share it with people. Anyone who asked, really. I wouldn't necessarily talk about me, but then if they had, certain conditions, I could say, well, have you tried this? Have you thought about such and such?
Absolutely.
Well, thank you for talking about it to us. I think it'd be really interesting for people. And I wonder if there's kind of any final advice that either one of you want to offer in terms of the whole progesterone conversation, because, I mean, I know from what I see online, especially in the Instagram community, there's talk about getting to that progesterone phase, when you've gone through your protocol, and then if you've had your transfer, and, if people are then getting nervous about it. I mean, I know you've said it's rare, but what advice would you give if people are starting to get, I don't know, a bit nervous?
I would say if they've got any symptoms, just to approach your clinic straight away and not be afraid to sort of, no matter how trivial it is, and it might be something just really, really trivial, and not be afraid to go in and just say, look, I've got this symptom, is this normal?
Yeah, and I think, just to reiterate that it is incredibly rare, and it can happen in a normal cycle without IVF, and it doesn't happen very often. So that's just showing you how rare it is, that it's something that, both Kate and I had never heard of. or never seen really to that degree within our practice. Therefore, it is a very rare occurrence. And given the fact that it
very much is. I mean, I'd scoured the internet thinking there must be someone out there, because in some ways you're just desperate to reach out to someone and say, oh, there might be someone else, and what do they do? But as you say, it's also knowing that it's really, really rare, but also that women can get, as you say, some milder symptoms, and it doesn't mean that it will be something as severe as this. But it's just acknowledging that sometimes these things happen, and you never imagine it could be you, really.
Wowzers.
Wow.
I'm just amazed. I'm always amazed at what I learn from doing this podcast, and that is the reason that we do it. And I just hope that if we have managed to put that out into somewhere and somebody finds it and it's of use, well, I'm sure it'll be of great use anyway. But Kate, thank you so much for your time.
Oh, no, thank you very much. And obviously, it's also to sort of reach out there to ladies who, if are going through lots of difficult times, to know that whatever decision that you make or whatever you decide to do, or, nothing lasts forever, and that, good things do happen. And I was determined really to make it a positive. One of my most proudest things was I ran the 2018 London Marathon for the Miscarriage Association.
Well
and that was just such, because I wanted it to be remembered as something positive at the end. And, my husband and I have now got 3 rescue dogs. Apologies, you heard them all before, just making themselves known. And I'm kind of having the confidence to say, I can do different things in life. I can go out there and give it a go, which I might not have ever done before. So actually, it's thinking, that it's made me a stronger person. And it's just, as you say, giving women the confidence to know if there is something that happens, that they can get through this. And
that's
they can,
amazing. Yeah, that's really good.
That's support.
That's a lovely, lovely thing to hear, Kate. Thank you so much for sharing that with us.
Thank you. And well done on that, running a marathon. I take my hats off to anybody that can do that.
It took me over 6 hours. I certainly made the most of the course.
Just taking it all in, soaking up the atmosphere. Best way to do it. All right, lovely. Great to chat. Thank you.
Thank you very much, ladies, and thank you for chatting.
You heard me struggling during that, because it dumbfounded me in that there's just such bizarre things that our bodies can do when we're trying to reproduce.
Yeah, and I don't think you're alone in the feeling dumbfounded. It is so rare. I've never, ever seen it to that extent, ever. And I think most clinicians, certainly from what Kate was saying, people haven't seen this. And as I mentioned, when I did my research into it, I found very little. I found one literature review that talked about it. And I think probably Kate's had it worse than perhaps some of the symptoms that were described in the review that I've read. But wow, I mean, yeah, horrible thing to go through, but hasn't she turned it into something so much more positive and lovely, really?
And I have to stress that when you email us saying that you'd like to share your stories, it's such a privilege for us to be able to talk to you, but also to then put that story out there, so to speak, because that's the point of the podcast. It's to answer the questions, help you feel less alone, make you realise that that weird thing that you've discovered you might be dealing with, somebody else might well have dealt with it. I mean, Kate, who we just spoke to, as she was saying, was such a rare case. But if you find that this is what you find yourself going through, which is probably unlikely, if the fact that you heard it spoken about on a podcast is of help, then we've done an amazing thing. And even if it just, if any, like Kate said, any of the symptoms start to present, it makes you ask questions. I guess it's awareness ultimately, isn't it?
It is. It's absolutely. I think it's so important to be aware of the things that can happen, good or bad, and you can make better informed decisions.
Get in touch if you've discovered something unusual on your journey to try and conceive. You can email info@thefertilitypodcast.com. You can contact us via our social media platforms, which are still different because Kate and I do other different things. So you can get hold of me at FertilityPoddy on most of your social platforms. What are you, Kate?
I'm at Your Fertility Journey.
And you can also join our closed Facebook group, which is Talk Fertility, where we do try and continue the conversation and answer your questions as well. And thank you, as always, for your support. Until the next time.